Hello, my name is Thomas Newcomb. I'm a student in your public speaking class, and I hope you can hear me okay. I uploaded a PowerPoint assignment with this same presentation almost, but I couldn't figure out how to make it more streamlined, and I thought that other video may not be accepted, so I wanted to give you a more traditional platform to YouTube. You may not see me, I'm still here. Hello. But I can't figure out a better setup than this at the moment. Still trying to figure that out every day. But this is going to be the same presentation on the electrical pathway of the heart. As a paramedic of the last 5 years, I think I have a bit of a firm understanding on this topic, which will allow me to present it much more confidently and more streamlined than my initial topic was. So let's get started with what exactly is the electrical pathway of the heart. As you can see with the picture provided, it is the path our heartbeat takes as it travels throughout our body, and it's a key vital function to life. And we're going to mention briefly some abnormalities, but ideally, in a healthy individual, there should be no disruptions to this flow. It starts at the SA node, or the sinoatrial node. What this does is it tells its heart, okay, it's time to go to work. We receive hundreds of thousands of these impulses every single day. This is what we call the demand pacemaker. What that means is that it sets the overall heart rate, or it tells our heart how it's going to beat. If your SA node's working right, the rest of your heart's going to work right. There are a couple of insufficiencies, but nothing of a crucial nature. This area produces the first sound we hear in a heartbeat after it fires. We call it the lub. Our heart rate is fired in what we call a lub-dub sound, and this is where it originates. Our impulse then leaves the sinoatrial node, or the SA node, and travels down the internodal pathway, marked on your ECG as the PRI interval. Okay, PRI interval standing for PR interval. So a PR interval. This is just how long it takes the impulse to start at the beginning and run to its first checkpoint. There can be some irregularities that cause a slower heart rate or a completely dropped beat sometimes. It then reaches the AV node, or the atrioventricular node, also called the AV junction. This is the main squeeze of the heart. This is where we feel our big beat. We talked earlier about the SA node being called the lub. We refer to the sound made at the atrioventricular area of the heart called the dub. So it's that boom boom or that lub dub. The heart rate here typically runs from 40 to 60, whereas the SA node typically sits between 60 and 100, or what we call a normal sinus rhythm. These are what we call ventricular junctional, because it's meaning at the AV junction of the heart, rating again from 40 to 60. This can run independent of the SA node, but not for very long. Patients who suffer conditions that make them start beating at the AV node typically have to have a pacemaker put in. Abnormalities to this heartbeat, a quickening or a drastic slow, can create a lethal arrhythmia. All the arrhythmia means is a abnormality to the heart, or an abnormal rhythm. We then leave the AV node and go to the bundle of His. There is no real significance to rate control at the bundle of His. What it does is it's kind of like going down the interstate. Think of it that way. And when we talk about the bundle branches, those are the little exits we get off of to reach our destination. There can be significant events such as heart attacks or strokes or drug use that can cause disruptions to the heart's ability to send impulses through. They either won't get sent through at all, or they'll get sent through in little tiny spurts, causing a wide variety of issues. We then leave the bundle of His and go to the left and right bundle branch. These go into the left and right ventricle, respectively, and control the actual big mechanical squeeze of the heart. This big squeeze is what makes the blood go all throughout our body. It's the most important stop, and arguably the first would be the most important, you would think. But this is that life-sustaining beat. It makes our blood fill with oxygen and then go out to all of our special little organs. This has, again, no rate on the heart, but no effect on the heart rate, excuse me. But what we can see are what called bundle branch blocks. All this means is that the electrical impulse has been blocked from reaching the left or the right ventricle. We see this in a lot of patients, both that are about to suffer an impending heart attack or have had catastrophic damage as a result of a heart attack or a stroke, or again, drug use is becoming more and more prevalent. These patients can live with these abnormalities or these blocks present. However, they get sicker and sicker as time goes on because we need our whole heart to be working in order to live a long, healthy, productive life. From the left and right bundle branches, we go into their respective Purkinje fibers. This is the last stop along the electrical pathway of the heart. This is your final line. If this fails, unfortunately, you won't have any heartbeat. We can see here this is going to beat at a rate of 20 to 40 beats a minute, a much slower heart rate than seen previously in the SA node. This is what we see in patients who are unfortunately not going to be with us much longer. We see them in typical incredibly sick people or people who are what is in active cardiac arrest. A common condition that Purkinje fibers cause is called a ventricular fibrillation, or when the heart goes and make your heart just shakes, but really doesn't beat, it doesn't produce a beat or perfuse any blood. So I hope you've learned a little bit about why it's so important to make sure we keep a happy, healthy heart. Because much like a good watch, you're no good to anybody once the ticking stops. Thank you, and I appreciate you listening to my presentation.